Cancer is the leading cause of death in the world. It refers to any one of a large number of diseases characterized by the development of abnormal cells that can't be controlled and have the ability to infiltrate and destroy normal body tissue. All over the world, the Breast Cancer Awareness Month is celebrated every month of October. But this video is dedicated to those people who are suffering from different types of cancer, and especially to the cancer survivors. In the next slides, you are going to meet them one by
one. Everyone, good morning, good afternoon, good evening, whichever part of the world you are. My name is Ezra V. Ballesteros. I am from the Philippines. I am married and I'm a mother of 2. I'm a nurse by profession. At the same time, I'm continuously nurturing my passion as an artist through our event management business as an event planner and stylist. I'm not sure if I'm the right person to talk about this topic, but I hope with this video I'll be able to give hope, uplift one's spirit, most especially those individuals who are experiencing this kind of disease.
I'm Darius M. Concepcion from Nueva Ecija, Philippines. I want to share my story how I battled my colon cancer.
I am Mrs. Lydia Adoptante, a cancer survivor. It is tough to talk again about the terrifying experience of mine in fighting breast cancer. I am doing this just to inspire others who are suffering that kind of illness. Don't give up. Fight for it. Be positive. Always remember that there is God. He knows everything. I would say that I am a brave woman.
How does cancer start in the body? Cancer starts to develop when the body's normal control mechanism stops working. Old cells do not die. Instead, they grow out of control, forming new abnormal cells. These extra cells may form a mass of tissues called tumor. There is one type of cancer that do not form tumor. It's called leukemia. What are the signs and symptoms caused by cancer? It varies depending on what part of the body is affected. Here are the general symptoms: fatigue, lump or area thickening that can be felt under the skin, weight changes, unintended loss or gain, skin changes like yellowing, darkening, or redness, changes in bowel or bladder habits, persistent cough, or trouble breathing. Let's watch again my guests, and they will tell us how they were diagnosed of the disease.
I was diagnosed that I have a cancer. It was year 2010, month of April, when our family is planning for an overseas trip for our son's tournament. My husband and I decided to undergo our daily routine checkup. So I went to my OB/GYN for a pap smear, and through the process, my doctor told me that she wants to take some sample tissue for biopsy.
In 2014, at the age of 38, I feel pain in my stomach. And suddenly, I feel dizzy. And also, every time I poop, there's a blood in my stool. Due to that, I went to the doctor and undergo series of laboratories tests like endoscopy and whole abdomen CT scan, and found out that I have a colon cancer stage 2A.
It was September 2003 when I diagnosed breast cancer. After all my laboratory tests, I was scheduled my operation exactly September 30, 2003. It was a successful operation. I felt normal, but the fact that I had only one breast left, it was not.
Cancer is a common disease. The vast percentage of cancer cases came from combined effect of hereditary as well as external factors, such as environmental and lifestyle factors. Cancer is not inherited. It is only the genetic defect that can lead to cancer that is inherited. According to current estimates, only about 10 cases of cancer is associated with hereditary predisposition. Is cancer curable? Cancer may be controlled with treatment. It might seem to go away or stay the same. It may not grow or spread as long as you're getting treatments. This is according to cancer.org Treatments Survivorship.
I met few doctors to seek different opinions, and after 1 month of searching, my family decided that I should undergo a hysterectomy and bilateral salpingo oophorectomy, which means the total removal of my uterus, fallopian tube, and ovary, and exploration of my lymph nodes, lower lymph nodes, to know the extent of the spread of the cancer cell. After the operation, all the organ that was removed was brought to a pathology for further examination. And after that, my doctor recommended that I should undergo a linear radiation and chemotherapy. They call it chemoradiation therapy. It was recommended for 28 sessions of linear radiation and 10 sessions of chemo session. As a nurse, I was hesitant with all this kind of intervention because of my experience with my cancer patient. But the family decided that I should undergo with this treatment. The linear radiation was painless, but the first chemo session was really a nightmare experience for me. Everything that I taste, I smell, it's like a rust. And one day, I was rushed back to the hospital. I fainted because of short of breath. And I was losing 2 pounds a day during that time. Little did I know that my bone marrow was affected by the linear radiation, and my lungs could not take the heavy metal component brought about by the chemo drugs.
I undergo open surgery to remove my big intestine. Luckily, it was transverse. And also I undergo 8 sessions of chemotherapy for almost 6 months. I'll take some vitamins and soft diets for my macronutrients.
I've gone through many laboratory tests again until my doctor suggested me to undergo chemotherapy. I followed doctor's advice. I undergo chemotherapy for 6 months, 2 sessions monthly. It was a very hard experience. Sometimes I couldn't take the effect of medicines to myself. I felt dizzy, restless, and I also vomited. My hair lost, my skin became itchy. Sometimes I don't want to go back to the hospital to do the next session, but with the encouragement of my loved ones, I finished my chemotherapy.
Managing cancer as chronic illness. Cancer isn't a one-time event. It can be closely watched and treated, but sometimes it never completely goes away. Aside from the chemotherapy and other medical treatments, Ezra, Darius, and Lydia tried organic diets and changed their lifestyles. Let us meet them again and see what happened.
Since my body became very weak, all the therapy was suspended. Since then, we live by faith. Through penance, we pray the rosary every day together with my family. We only take natural food, anything natural, no processed, no canned, more veggies, fruits, and avoided meat.
I feel so depressed and thinking that I will not recover anymore. After my last sessions of my chemotherapy, my oncologist doctors told me to have a yearly laboratory test again, like colonoscopy and a whole abdomen CT scan for 5 consecutive years. They found out that I had no longer cancer in my colon.
I became brave because of my loved ones. When I diagnosed with breast cancer, I was only 36 years old, and now I am proudly say that I'm 55 years old. I am cancer-free for 17 years, thanks God. So I believe that faith in God, prayers of others, support of loved ones help me a lot in fighting breast cancer. I hope you inspire in my testimony. Thank you and God bless.
Now that I found out that I am a cancer-free person, I thank God and my family, especially my wife. Due to that, I changed my lifestyle, more exercise, and eat healthy food. To God be the glory, thanks to be God.
When and who confirmed that I'm already cancer-free? With the 6-month struggle that we're being in and out of the hospital for that year, I still see my doctor every month. Then after 3 months, 6 months, year after year. And up to now, with God's grace and God's faithfulness, medical test shows that I'm in complete remission. What do I look forward now as I am a cancer-free person? With my status now, I remain faithful to God, full trust in Him. My family and I are still praying the rosary every day. And I'm looking forward to see my children spread their wings and can fly high with God's direction.
Cancer differs widely in their prognosis. The stage of cancer at diagnosis is more relevant to the survival of individual patients. In most statistical records, cancers are grouped by location, although cancers of the same can have extremely variable survival rates depending on the type of cancer.
Yeah, it's me Captain. Mainichi bakuma
This is the end of my video about cancer survivors. I am grateful to Ezra, Darius, and Lydia for granting my request to be featured in my YouTube video. And I wish you all the best in life, happiness, and remember that your life is your story. Write well and edit often. Take good care of yourself and stay forever healthy.